The following content is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. You're listening to the Everyday Therapy Podcast. I'm JC Rader.
And I'm Julianne Schroeder.
And we're therapists bringing you honest conversations around emotional wellness and self-development.
Inspired by our personal experiences in therapy and because of our clients, we realize therapy has so much to offer both on and off the couch. Listen for tips and tools to navigate all the challenges that life throws your way.
To give us feedback on topics and guests, or for more information on our community events, counseling, or online services, contact us at everydaytherapypodcast.com. And we are with White Rock Counseling. You can find us at whiterockcounseling.com. We're both psychotherapists there as well as individual yoga teachers. So for mental health. Let us know if you have any mental health questions. We love talking about mental health, obviously. And yeah, let's jump into our topic of today, and it's a little bittersweet.
Are we going to tell them?
Yeah. So this is our last episode for a while, so we're going to take a little bit of a hiatus and try some new stuff out. And
yeah, but we've been so grateful for this opportunity to really share with others and just spread our mission and making sure that we can talk about things without shame and rely on others. And so thank you for all who've listened.
Yes, all our fans
all
out
our
there.
fans out there, Mom, Dad,
Nana, Matt.
Major props to Matt. He was the MVP.
Yes.
So, we just want to say truly thank you for any of those that listened and supported us. It's been fun.
And keep reaching out to us, sharing what episodes you like, or if you have any other suggestions, and who knows what will happen from here.
Yeah.
But today we're kind of going to do a best of episode.
Yes. The best of coping skills.
Yes. Which is, kind of a reason that we got this started is to educate, decrease shame, but also share what are some of the little things you can do that we teach in therapy that, everybody can do.
Yes.
So, and I was thinking about preparing for this episode, and I was trying to break down coping skills in my head and the different types of categories. And so I'm curious to hear your thoughts on this because we haven't even really discussed it.
We're live, folks.
Yeah. But I don't know, coping skills are a big buzzword, especially in counseling and therapy. It's kind of that psychobabble, just jargon, But what is a coping skill, right? Yeah. And so, it's something to you have an overwhelming emotion and something to deal with that. And so I guess some of the ways that I break it down is there's insight-oriented coping skills to help you build self-awareness and insight, an understanding, a learning. Mm-hmm. And then you have your coping skills to help you change emotions. So that would be emotional regulation, if you will. So I'm anxious and maybe this isn't appropriate for the situation. I need to change it. And then tolerating emotions, coping skills to tolerate emotions. Mm-hmm. So I'm feeling anxious. That's, necessary for the situation to be anxious. How do I deal with it? Yeah. Or it's just there. Those are kind of the way. Oh, and then the last one would be coping skills, interpersonal skills. Mm. So being able to cope with relationships.
Yeah, how to handle conflict.
Yeah.
Yeah.
I don't know. How do you break down coping
Yeah.
skills in your head? Does that fit for you
For
or?
sure. Yeah, no, I love that. I see coping skills as really life skills,
Yeah.
right? We're gonna
Yeah.
encounter
Life
stuff.
hacks.
Yeah, and like encounter things that are gonna throw us off. A calm state, and so it's like necessary to know these. But
Yeah. And
yeah.
yeah, I mean, that's a good point too, is like sometimes they're like learned growing up. Like maybe you have kind of a parent with more of a toolbox. Yeah, toolbox, a book of tools. And then maybe like you just don't learn them.
Yeah.
You know, maybe your parent does have the toolbox, and you don't pick them up or learn them
Yeah,
either.
we haven't talked about this either. Oh, we're just going off the wall here.
Yeah.
Do you, if you were to think back to your childhood, um, did your parents demonstrate any healthy coping skills? Like
Oh, I'm sure
overtly
they,
or
yeah,
like did
I'm
they?
sure they did. But
Yeah.
yeah, I mean, your go-to is like all the unhealthy ones or maybe unhelpful ones. Like I like terming it that way.
Mm-hmm.
But yeah, one of the things I really appreciate about my mom is her apt to like lean towards like counseling or therapy, which is
Mm-hmm.
why it was like such a open topic in our household. And so I don't know, I kind of see that as a skill. Like her
Yeah.
go-to was like, well, we need to
Let's
go
be
back to
open and
therapy,
yeah,
or we need to,
to receive help.
yeah,
It's a
we
it's a
need
coping
some
skill
support.
to practice receiving help and seeking
Yeah.
support for sure.
Yeah. That was a big one. I don't know what comes to mind for you.
Um, a lot were spiritually inclined.
Mm.
I think so really helpful in the sense of being able to try to determine what was in control and not.
Mm.
And then gratitude is one that easily comes to mind.
Oh, I love
Yeah.
those. Those are good. Yeah. And it doesn't have to be like these specific things that these theorists have created,
Right. Yeah.
like
Yeah.
that's
No,
so
my parents,
simple.
yeah, they themselves have never been to therapy, but like did
Yeah.
model healthy things in these ways. So,
Yeah,
yeah.
for sure. There's also a lot of yelling in my household and
Yeah.
like the unhelpful
For sure.
ones too.
Yeah,
But
and there was at times a not discussion of kind of conflict avoidance. So yeah,
yeah,
interesting. Yeah.
for sure. For sure.
But yeah, we all learn what we have been taught to, right? And I, just want to acknowledge like that the older generations, um, you know, being more inclined to mental health and knowing what to do wasn't necessarily always encouraged.
Oh my gosh.
Yeah.
I love that you said that because
Yeah.
I have so many of my younger clients that come in. They're like, my mom just does not get it. She just does not talk about this or that. She is not vulnerable or authentic. And so, yeah, it's this like space of like kind of understanding that maybe that wasn't normal 20, 30
Mhm.
years ago. Like this is kind of a newer thing
Yeah.
to open up.
And then taking it into account like cultural considerations too,
Yeah.
right? That like Asian cultures, even like Hispanic cultures, problem, and even the Black community too. Like, you just if you are to address any problems, it's either through the church or you don't, or within the family, or you just don't talk about
Yeah.
them.
Definitely.
Yeah.
Yeah, I think we say this a lot on this podcast, but everybody's kind of doing the best that they have with the tools that they have, and that's really helped me like have compassion and empathy for my family
Yeah.
specifically, and then clients that you get frustrated with. You're like, I want to help you so bad. I know you want it to, but just like won't go there with you.
Yeah.
But
Yeah.
we're all
Absolutely.
doing the best that we can.
For sure. Yeah. And then it's on our journey where we become more open to like hearing and implementing things that can potentially make things a little easier for us.
Yeah.
And I
the
do want to
ultimate goal.
clarify too that coping skills doesn't mean that like somehow then your life is gonna be peachy keen.
Oh,
Right.
yeah.
Like the category that you described, coping skills sometimes are just for tolerating, right?
Yeah, getting through a situation and not
Right.
making it better.
Yeah, because for example, if we talk about grief, right, there's an acceptance that has to happen, and that things aren't going to necessarily change.
Oh, definitely. Yeah. Yeah, I just thinking about like all the grief in my life, everybody's life that we have, I wouldn't want to take some of that away. Like it would take away the meaning of like the person if I didn't have that. So yeah, that is so important to be able to sit with it. And,
Yeah.
yeah.
And yeah, part of using coping skills effectively is to be able to discern what type of coping skill we
Right.
need and what the objective is and like a reasonable expectation and outcome.
Yeah.
Yeah. And then I also want to add too, when you were thinking about categories of coping skills, I think about like timeliness of using coping
Okay,
skills. So you
yeah.
can have like preemptive, right? And I mean,
Coping ahead, if you will.
yeah.
Yeah.
Yeah. Making a plan or kind of like just the regular things that you do to keep yourself centered and grounded and aware.
Yes.
Like hashtag self care, right? In
Yeah.
that way. And then you can have in the moment crisis skills. So, like if you're in a, really going at it with, a friend or a partner and having conflict and need to de escalate or you're having a panic attack where you're like you're in crisis and then you can have I don't know what I call it
Post coping.
post like self-soothing
Yeah. Yeah.
right, so like
After
post the
the
blow
fact.
up or
Yeah.
post the really anxiety provoking thing. How do you take care of yourself? What are the I would say self-soothing things that you do?
Definitely.
yeah.
Yeah. Can we talk about like what are like, well, we're good. Our whole episode is on helpful coping skills,
Yeah.
like giving that out. But what are some of our like unhelpful or
Oh.
unhealthy coping skills?
For sure. Like retail therapy.
Oh, yeah. Yeah.
Yeah. Also staying busy.
That's a good one.
A lot of people do.
Yeah. And I can even fall into like, oh, I'm doing my self care and then be too inactive almost and kind of like disconnected or checked out a little bit
For sure. Avoiding.
too. And can we address food? So
Oh,
I think
yeah.
a lot of people think that like it's unhealthy. Even you said retail therapy,
Yeah.
right? Like people say like I'm emotionally eating or like overeating or undereating even as a coping skill, which some of these things are like okay,
Yes.
like in moderation. Like I do like to shop whenever I'm not feeling good, and that's okay as long as I'm not going against my values or
Right. Over budget.
hurting myself.
Or that's the only thing that you do. Right.
Right.
Like, you
Yeah.
gotta have a diversified like coping skill because I mean after a while like Target only has so much. Right.
You can only fill your house with so much Target decor.
Right.
Yeah.
Or yeah. So you might just want to be
Closet.
aware of that.
Yeah.
Although
yeah,
they have some
for sure.
really cute home decor. It always
Yeah,
seems
they're
to be
killing
like
it.
expanding.
Yeah.
Anyways.
But what
Yeah.
do you, can you talk a little bit about like, I guess the food component of like, because you see a lot of clients with disordered eating, eating disorders, and yeah, what does that look like in conversation? How you kind of explain that to people?
Yeah, no, I think you touched on it, and I don't know if I have too much more to add than what we're discussing of understanding that at times, with anything, we're going to cope in a way with knowing what is available to us. And so, yeah, it is okay to emotionally eat at times, but sometimes we emotionally eat when we're happy. Like, have you ever
Like
done
excited.
that?
Oh yeah.
Yeah.
Watching The Bachelor and I eat 2 bowls of popcorn. Yeah.
See, I'm in panic mode watching that. So like I cannot see what's going to happen. So I'm eating out of like fear.
Distraction.
Yes, distracted, cannot tolerate the cringiness of this. Anyways, yeah, so I mean it happens I think with any same with like if you drink and you might have an extra margarita because you're nervous about something meeting somebody or or you're stressed out and you just want to relax.
Yeah.
So it happens. I think the duty is in terms of being honest with yourself. How frequent is it happening to the intensity of like, how much are you undereating or overeating consistently? Same
Yeah.
with drinking, same with spending money, same with like keeping a busy schedule. Like, yeah.
Kind of like a checks and balances.
Yeah. Yeah. And how much is it impacting your life?
Okay. Cool.
Yeah,
Yeah.
fair.
No. Yeah. I feel like that's super helpful.
Yeah.
So yeah, we're just going to go back and forth and just each share
Yeah.
See how
Some
far
of our
we get.
favorites. Yeah.
Yeah.
So let's see how many we can knock out.
Yeah.
Okay.
Perfect. Let's see. So I feel I identify with having like being a highly sensitive person. I think we've both shared about that. And I do like I notice my emotionality is higher than other people's. Like whenever I'm feeling something than the normal person. Like I would say I feel I it appears like I feel it more intensely. So these have been like super helpful for me. Um, okay, let's see. I'll talk about this one first. So it's called HALT, and I want to say it comes from recovery,
Yeah.
maybe 12 AA or
Yep.
12 step. Okay. Um, and so it's very simple. So it's an acronym to help you remember, like, if you need to take care of these things. So being hungry is the H.
Can't be hangry.
Yeah. Am I angry? Am I lonely? Or am I tired? And so those are like some of the primary, like emotional, physical things that can happen to make you vulnerable. And in recovery, it would be to relapse. But I think even just like in a vulnerable place to like not handle a situation like
Yeah.
you would normally handle it.
For sure. I have so many of my clients, I don't know about you, that they come in and they're like, I don't know why I'm feeling this way. And you know, they're really smart. So they're like trying to draw meaning from whatever's happened, whatever
Yeah.
interaction. In reality, they're tired.
Yeah. It's like,
Right.
did you eat lunch
Yeah.
today?
Yeah.
No, I haven't eaten all day. It's like, well, let's start there.
Yeah. Yeah. Like, you know, basic fundamentals,
Yeah.
right? Like Maslow's hierarchy of needs. Like if they're not met, then we're not going to be like, obviously we're not going to be self-actualized
Yeah.
if we're in a hangry state or if we're scared or alone. Yeah.
Yeah. I love that simplicity of that one. Hangry is the big one, and tired
Yeah.
for me really trips me up.
Yeah, for sure. And loneliness.
Yeah.
I don't know. I think,
I feel like I'm pretty good at that
are you?
because I'm like constantly in contact, which maybe says something about me too with people. But I mean, I still feel loneliness, but yeah.
Yeah, I think for me, when I've felt lonely, it's easy for me to get in my head, and that's when like the inner critic really turns on. Of like, what's wrong with this, and this, like,
Yeah.
and just kind of a tendency for that to kind of take over. So I know I have to,
Definitely.
be aware of that.
Yeah, and I totally can relate of like whenever you're too in your head, like whenever I say it out loud, I'm like, oh, that's silly.
Yeah.
But yeah, if you're just in your head for hours or a whole day, like that's a lot to be up
Yes.
there.
Yeah, have to learn to manage.
Yeah.
Yeah. And speaking of, that kind of actually segues into one of my favorite coping skills is when you're in your head, practicing thought diffusion and developing a witness mind.
Okay.
Okay.
Explain that one.
Yeah, let me break it down. So I think many people, and you and I included, have sometimes taken our thoughts at face value.
Oh.
Right.
Yeah.
Like, I'm a failure. You know, nobody likes me, or I'm not good enough.
yeah.
Right. I'm just naming some
I can get
thoughts.
some crazy thoughts up there. Let's not use crazy. That's not appropriate, JC. But some pretty
Yeah.
wild thoughts sometimes about my partner of like, oh, he did this, he doesn't care about me, or something.
Yeah.
Yeah, which is so not true.
Right. Right. And so, one, I think we have to be aware of that, especially if you are predisposed or have an inclination to struggle with, you know, any sort of mental health disorder, anxiety, depression, PTSD, whatever, you are going to have a lot more thoughts than the norm. So, like on average, I guess what they're coming up with now, 50,000 thoughts for a quote unquote normal person. But if you struggle with any mental health condition or ever have been, yeah, that's going to be at like 70 to 80,000 more thoughts and that's where you have to work to manage and divert and navigate. So I just want to name that
Yeah.
of, yeah, just knowing that there's going to be a lot of energy.
And within
Yeah.
thoughts, a lot of assumptions.
Yeah.
If you're having 20,000 more thoughts. That's a
Yeah.
lot more room for assuming things.
For sure. Yeah. And then I just want to too, because like chronic stress is an epidemic that if you're overloaded, you could have stress induced anxiety. I think that's really common in our society. And if you're a highly sensitive person, you are going to have a lot more thoughts because you're intaking more information and just have a more sensitive nervous system.
Yeah.
So, all those things, take that into account. So we need to learn to wrangle our thoughts and not like go, like kind of attach to them and like spiral
Yeah.
into, right?
Make meaning out of
Yeah.
the thoughts versus like what maybe is true for the situation.
Yeah. So I love a component of acceptance and commitment therapy. It's called thought diffusion. In yoga world, it's being a witness or an observer.
Like non-attachment
Yeah.
in a way.
Yeah, exactly. So if I were to get super specific about this, it's really shifting from having the thought, say, I'm a failure. And then that makes you just feel so defeated, like self-loathing, or maybe it makes you feel anxious as well. So thought diffusion is essentially just naming like, oh, I'm having the thought that I'm a complete failure. And so can you hear even as I say that, like
Yeah.
a difference in the emotionality of if you're being a little bit more objective versus in the feeling state?
Yeah, absolutely. So I'm a failure versus like maybe it's like I feel like I'm failing or
Or I'm having the thought. Yeah.
okay, I'm having the thought that I'm failing.
Yeah.
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 Definitely. I mean, that's a big difference. It's simple, small,
Yeah.
but a huge difference.
Yeah. So yeah, not accepting the thoughts as our reality right away. So it gives you time, like, and it doesn't mean that you have to shift from I feel like a failure to I'm the best thing in the world.
Yeah, it's
No.
not rainbows and unicorns.
Yeah.
Like we're not saying positive psychology it up and
Yeah,
like,
or that you have to change the thought.
yeah.
Right. But I think an easy next step is just to remove the emotionality by stating it more objectively.
Yeah.
And then you give yourself a chance to think about, okay, really, well, have I failed in the entirety of my life, right? Okay, maybe there was a mistake here, but does that mean that like all my success to this point is null or that I am less of a human as a result? So it gives you like a little room to start to challenge like those
Yeah.
thoughts and beliefs.
Yeah, to get more into it. Yeah,
Yeah.
so like the simple aspect of it is to say I'm having the thought that.
Yeah.
Like be aware of what you're thinking of.
Yeah. And you'll hear maybe too nowadays people talk about like naming the stories. I'll talk about clients with that in terms of like trauma and beliefs that they have formed as a result of being able to kind of say, oh, here's my trauma story, right? Where I feel like I'm unlovable or that, nobody is ever going to accept me. So that's a little bit more nuanced, and I think probably takes some help in kind of figuring out what your stories
Navigating
are,
that.
where they are, yeah, and understanding like how you have come to believe that. And so once you understand how, then you can just name, and then you start to investigate. Okay, is that necessarily true right here, right now?
Yeah. There's a lot to therapy, folks.
Yeah, yeah. So
Go
we're trying to
go
yeah.
to therapy, but also try I'm having the thought.
I'm having the thought
Yeah.
that I'm unlovable, or I'm having the thought that I'm going to fail.
When do you notice that is like most effective or most helpful for you? Or can you give us a personal example of something?
I think it's helpful anytime.
Yeah.
Anytime I think that you have thoughts that might touch on like a vulnerability of yours. So I'll just name some common vulnerabilities for a lot of people. It's fear of rejection, fear of failure. That's why I keep saying that one, right? Fear of not being able to trust oneself or others.
Yeah.
Yeah. You have anything to
Yeah.
add?
Well, I'm curious. So,
Yeah.
like, just thinking about, and we don't have to get into this too much, but like along the lines of self compassion, like, and Kristen Neff talks about how like we're all kind of average and that's okay.
Yeah.
Right? Of like even using that for like when I'm feeling like a rock star of like, oh, I'm having the thought that I am like doing really well right now, you know? 'Cause
I like
some
that.
of
'Cause
that can kind of like, I don't know, make me puff up a little bit and get out of like my humility and
yeah.
yeah.
Well, yeah. And I could see how that would create a lot of pressure of, oh, I did really well. Now I have to maintain this.
Yeah.
That's what a lot of my clients kind of deal with that of,
That or
okay,
it's
what
like
next?
a pendulum, you know,
Yeah.
of like, oh, I'm really awesome, and oh gosh, like, let's keep it neutral. I'm having the thought that,
Yeah.
yeah, whatever.
Yeah.
So I
No,
don't know,
thanks for
just a
that.
thought, yeah.
Yeah.
Okay, let's see. Okay, another one of mine. Let's see. So I am a big journaler.
Yes, you are.
Yeah, I love to journal. I have some of my journals from when I was like 14, and I've had it almost like probably I go through about one journal a year. So I've always been
Yeah.
that
So
way.
you've refined this coping skill.
Yeah. And it's a lot different than it was.
Okay. What did it start off as? So like the emo teenager just like writing about everything?
Yeah, I think a
Yeah.
lot of negativity, just kind of dealing with like overwhelming emotions, like, you know, like feeling really whatever teenager feels, but like isolated
Angsty.
and
Yeah.
different. And nobody understands
Nobody
me.
understands me.
Yeah, yeah. But what I like about journaling is like you can use it for so many things in the sense of like it can be a coping skill for like separating from your emotions. So almost like the thought idea of thought diffusion of like getting it out on piece out of your brain, out of your mind, like on a piece of paper. You can kind of see it, you know, and see if it really fits for you and give you time to like decompress, process everything. It can help me like self-reflect in a sense of like being honest with myself and kind of seeing like, oh, this isn't really fitting for me. Like I need to shift something. And so those are kind of the two main things that I use it for. And I guess I like put a lot of skills within that. So I'll do like gratitude in my journal sometimes, or yeah, like whatever I'm like working on individually, like kind of keeping track of that. And so we know that with like making behavioral changes, that you're more apt to make a behavioral change if you write things down and you track something. So some sort of tracking. But yeah, what about you? Are you a journaler?
Not consistently, but I did
Yeah.
want to add because I know this about you.
Yeah.
You are actually using journaling, excuse me, as a way to enhance creativity, right? It's with your morning pages.
Oh, okay,
Yeah,
yeah.
isn't that?
Yeah,
Or,
I try different types of journaling. But yeah, more recently I have started doing morning pages, which is just this idea of writing for 3 pages and getting everything out of your mind. And I do like different activities like this, homework assignments for clients. But it allows for you, so maybe I'm like anxious about something and I can only write 1 page about it, but I get that out of my head, and then I have to fill up the rest of the 2 other pages, and it kind of gives me space and time to reflect and like kind of go out of my normal, you know, world, I guess, a little bit.
yeah,
What else comes up for me?
yeah.
Because you kind of just got to sit there and fill it up.
Yeah.
So that's a cool,
Good practice. Yeah.
yeah. But there's a lot of different, I don't know, ways to journal.
Yeah,
Yeah.
absolutely. Yeah, you can kind of think about maybe what you need or what you're wanting to get out of journaling,
Yeah.
kind of like backward design. Okay, what
Yeah,
do I
what's
need?
my goal?
And then like figure out how to do that. I guess I'll say real quick, I have noticed that when I do journal, a lot tends to be more affirmation based. So I have a hard time always saying affirmations out loud. I don't know. Maybe other people can relate. Like it feels like just a little forced at
Yeah.
times, but it's easier for me to do that on paper. So I do that. And for me, I think it also really encourages the practice, or oftentimes in me working through whether it's a upsetting situation or making a big decision, I kind of through my journaling figure out what is in my control, what's not. That tends to be a theme. And then I also get really practical too, doing like pro-con lists. Sometimes just like seeing it there.
Yeah.
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 And then goal setting through
yeah.
journaling too.
Right.
Yeah. So that's how I use it.
Yeah. No, those are, I feel like helpful.
Yeah.
And way different than me too. Yeah.
Yeah. Lots of benefits there.
Yeah.
Okay. I know we both actually had settled on another favorite coping skill.
Yeah.
So one that I love, probably born out of my non-assertive teenage self, um, is being able to appropriately communicate needs and handle conflict. So,
Yeah. And I feel like a lot of counseling is teaching people this, like awareness of needs and how to communicate it.
thank you.
Yeah.
Oh, that was so great.
Yeah.
Yes.
It's just, what I'm trying to say is I feel like everybody kind of struggles with it.
Yeah.
Yeah. Or most people.
Yeah. Yeah. Might not.
Majority.
Yeah.
Yeah.
Come to mind easily. So, dear man, that's a DBT skill.
Yes.
And we have talked about this before. So I'm just going to briefly run through it. And then you can always Google, like literally Google DBT Dear Man.
Yeah.
And you'll have some helpful guidelines. But I found on this one worksheet, something that I really like is that you think about an event, right? Probably something that's going on with another person that has caused some sort of upset for you. And then you ask yourself, what do I want to change as a result of my communication? How do I want the other person to feel about me? And I'm going to put a caveat on this. That doesn't mean you can make somebody change, but just
kind of direction.
yes. And then how do I want to feel and see myself in this situation?
Yeah. So those are good journaling prompts.
Yeah, exactly. Or you could do a visualization if that's more your thing. But okay, after you've refined those goals, you're going to hit the first letter in the acronym Dear Man, D, and you're going to describe the facts as you would say to them to another person.
Yeah, kind of lay it out there.
Yeah. You're going to express your opinions, feelings, and desires about these facts. And oftentimes, people here kind of shift from their own experience to kind of looking at the other person and saying, like, you make me feel this way.
Yeah.
And so just
I statements.
I statements only. Then you assertively ask for what you want and you reinforce it by saying, however, what the request would do for you.
Yes.
So, for example, well, I'll get to the example at the end. Then you can describe any strategies for being mindful. And you can describe any strategies to appear confident. And then you can be prepared to negotiate appropriately.
I love that one, the negotiation at the end, because I feel like what I hear from a lot of my clients is that, oh, I don't want to ask for this. What if we get into a fight or they don't want to give me that? I say, well, that's okay. Then we negotiate. And if you kind of preface with that or go into it with that, it's like, oh, okay. I don't know. It just takes this pressure off of like, this is what has to happen if I ask for it.
Yes.
Yeah.
There's
so it's kind of this all or none. Either I don't ask at all or I ask and I have to have it,
Yeah, no, I see that too. And I hear that with clients. And another benefit to doing this, I also, encourage people like, okay, what do you want out of it for you? Right? So many of the clients that maybe your clients can relate to, they want to be able to feel like they are standing up for themselves and to feel heard. And so I'm like, well, you can do that for yourself. Now, there's no guarantee that the person is, going to honor your request, but like, can you feel satisfaction in your own self-respect by at least being able to say out loud?
Yeah, for sure.
So, do you want to give an example of a assertive communication strategy?
Yeah. So it's describe, express,
Assert,
assert,
reinforce, and be mindful, appear confident, and negotiate.
Okay, so the first four are
really,
the what, right?
yes.
What you're doing, and the last three are like how you do it. Okay, so I have one that like plays into this, but it's an assertiveness communication formula. So you just plug in words, okay? So when you yell at me, I feel blank, hurt and sad. I would like you to talk calmly, and that would help me be able to like share what's going on with me or have a dialogue with you. So when you blank, I feel blank, I want blank. So I don't know. I just like that because it's so simple.
Yeah.
And both are, I feel like the Dear Man kind of gives you the ins and outs of like why and what you're doing.
Yeah.
And that's like, okay, I hand that to a couple and I'm like, practice this, go home.
Yeah, no, I love it. Like, this is the basic starter kit.
Yeah.
Dear Man is the elevated.
Yes.
I think
Grad school.
Yes.
Yeah.
I think Dear Man can be helpful for like a lot of self-reflection almost. And then, yeah, it can give you enough to just do the basic,
Yeah.
which is, important. So,
Yeah.
love it.
I love it. The rest of mine are like pretty, like there's a lot that goes into them.
Okay.
I guess, I mean, one of the main ones that we haven't hit that I go back to, I mean, since I've learned it is breathing and mindfulness. And just feel like there's a physiological component to it of like kind of this idea of we have top-down approaches, which are kind of using our thoughts to control how we feel or change how we feel, tolerate how we feel. And then bottom-up approach is using our body to like tell our mind things. And so sometimes when I don't have access to be like, JC, it's cool, chill out, like I use my breath to do that. And the simplest way that I do it is to extend my exhale. So deepen my breath and like using my diaphragm. So big, deep belly breaths. And sometimes I can do it for like a minute when I need it on the spot, kind of that like crisis coping skill. And sometimes I try and do it regularly because I know if I do it regularly, my body is like used to it.
Yeah.
And it's already relaxed and grounded. So I'm not as vulnerable, I guess, to have an overwhelming emotion.
Yeah.
Yeah. Do you have anything to add to that? I know you use mindfulness and breathing.
No, I think the more you do it, the more you reap the benefits and the ability for you to be more resilient to periods of stress. I've noticed that for myself. So I've shared before, like I legitimately have some PTSD from some car accidents, and like it really
I can vouch for that.
yes, it was scary to have her like drive as I was like practicing not avoiding and having to like just get back on the wheel. Anyways, so my quick story and plug for you to really try and commit to even like 3 breaths once a day is something. Intentionality about it is everything. But yeah, I was pulled off on 75, like my tire blew out, and I was on the far left side and just, lots of cars. It's so busy, just, just whizzing by me. And I swear, like it was like I was like out of my body in a sense of like I saw myself just being so calm of like, oh, my tire is blowing out. Let me come over here to the side and then let me call AAA and then let me just sit here. And I actually breathed and meditated while I waited for AAA to come. And yeah, it was just all I'm saying is like, give it a try.
Yeah.
Keep it
I
up.
think it can be helpful to like find one of the apps. There's so many out there.
Yeah.
Just do a Google breathing mindfulness app, or some type of program, something to hold you accountable, keep you consistent, a buddy, something like that too. Like you said, because I think it is more impactful. If you do it once, you're gonna be like, "What the heck? That did
didn't
nothing."
change. Yeah. Pair it with something that you do every day. Like I have tried to do more intentional breathing as I'm driving to work, even though I know I can't like fully focus on my breath because I still have to be aware enough to like operate the vehicle.
You don't close your eyes.
I
And,
don't close my eyes,
oh,
people. But you know, like just this idea of being somewhat conscious and being in control of what you're doing is, really translates to a lot. So, anyways, good suggestion.
Yes.
I want to talk about something that maybe we haven't really dove into before, but guilt reducing techniques.
Oh, I saw that on your list. Please
Yeah.
tell me. I need
Okay.
these.
Yeah, for sure. Okay, here's my first tried and true one. So write whatever is going on that you feel guilty about. Journal it out. Since you're journaling.
Real quick, is this things that like I'm aware that I shouldn't feel guilty for, or
Just when you're experiencing guilt, you
In
just
general.
like naming your experience.
okay, more often than not, I feel guilt, and it's not true.
Right.
I guess is what
Right.
I'm saying. Yes. Okay.
So you just write it down and then scrunch it up into a ball, and then you just drop it, and you just drop the guilt.
Yeah.
Okay, I'm being a little facetious.
Well,
Yeah.
another
Yeah.
diffusion technique.
Yeah.
I feel like you're getting it out and you're getting
Yeah.
rid of it. Kind of the symbol of that.
Yeah.
Yeah.
Yeah. And what I'm saying too is like you can't easily just drop the guilt. Okay. But a more refined technique, I think, would start with writing everything that you think you should, air quotes, feel guilty about. And then look at and try to challenge yourself by saying, okay, where is there possibility that there might be one less thing I could feel a little less guilty about? Okay, so let me give you an example. Since I work with disordered eating, frequently there's guilt associated with food for some. So they might be feeling guilty that they had a food that was out of their norm. You know, I'm just going to say pizza. And so I would challenge them to come up with one reason why they could feel a little less guilty. And that might be other people eat pizza and that's okay. Right? Or I didn't have pizza for breakfast, lunch, and dinner, so I think that's okay. Right? So you're just like trying to get an edge into the guilt.
Because guilt
Yeah.
can be so damaging.
Yeah, overpowering for sure. And we don't have enough time to do this, but I think a lot of it is knowing where that guilt is coming from and typically like your roles within childhood and potentially
That
any trauma.
awareness and
Yeah.
insight
Yeah.
developing there.
I also love using permission slips. So kind of think of, in other words, affirmations, but like writing on a sticky note when, say, for example, you feel guilty for taking time for yourself or that you have to say no to someone. Writing out, I don't have to feel guilty. I'm allowed to say no.
Yeah.
But it's just like a visual reminder. Helps you, just same with thought diffusion, begin to challenge what you think as the absolute truth.
I love that because I love the personal bill of rights. So you can Google that, and it's this list of things that we all have a right to do. So I have the right to change my mind, to say no, to make mistakes. So to go a step further and to really like send it home and write it out and give it to myself. I have the right to say no.
Yes. Yes, I love it. And I guess we could talk. I realize
this could be a new podcast.
Yes,
Coping
yes.
skills.
So those are
101.
just a few of our favorites,
Yeah.
but of course we know more. So
And
if
we
you're
would
interested,
love, to hear from you guys of what your favorites are, or maybe some ideas of what, you need coping skills for. So yes, but on that note, goodbye. We will miss
Farewell.
you, and
Adios.
hopefully we'll see you soon. Yeah.
Yes, and please take care of yourselves and know that we're here to help connect you with anybody that you might need or if you need our services. So thank you.
Yeah. Thank you. It's been fun. Thank you so much for listening to the Everyday Therapy Podcast. Don't forget to rate and review us on iTunes and share with your friends. It really helps us reach more people.
We might only record once a week, but we're with you every day.